What is telemedicine? Telemedicine is making healthcare practices more accessible and cost-effective by using digital information and communication technologies to enable healthcare when distance separates the physician and the patient. It includes a wide array of services that we'll be exploring in this video. The concept of telemedicine has its origin in telecommunications technology, or the transmitting of information using electromagnetic signals. The earliest form of this technology include the telegraph, telephone, and radio. During the Civil War, the telegraph was utilized to report war casualties, as well as to order medical supplies. Later on, the telephone was invented in 1876, and the first radio transmission was performed by Mr. Hertz in 1887. By 1925, the concept of telemedicine was solidified. Dr. Hugo Gernsback designed the teledactyl, a tool with robotic fingers for examining a patient from a distance while displaying a video feed of the patient for the doctor. Although Dr. Gernsback's invention never made it past the concept stage, it did lay out the groundwork for the widespread telemedicine definition that we refer to today, a remote video consult between a physician and a patient. The expansion of telecommunications had a domino effect of inspiration in the medical field. By 1948, the first radiologic images were successfully transmitted 24 miles across telephone lines. Shortly thereafter, Montreal constructed a teleradiological system around its city. By 1959, the University of Nebraska achieved the next level, using television transmissions to communicate medical information between clinicians. As time went on and technology continued to advance, the U.S. government began to recognize the true impact of telemedicine. Many departments were supportive of continuing to advance this technology, and some contributed research funding. In 1972, NASA funded StarPac, or Space Technology Applied to Rural Papago Advanced Healthcare. The success of this project and similar ones have incentivized research in medical engineering and advancements in telehealthcare devices. There are several classifications of telemedicine systems. Live interactions are conducted in real time via video conferences between patients and providers or between healthcare providers. The benefit of this method is the transparent exchange, which promotes trustful relationship between parties. The second classification involves storing and forwarding of patient information for clinician assessment. These systems also enable the transfer of information between healthcare organizations. Think electronic health records. The third classification is remote patient monitoring, which is highly favored by patients in remote settings or those who are transportation disadvantaged. These systems enable patients to be monitored in the comfort of their own homes.
Go into the computer and on to tape.
During a telemedicine session, patient information is captured using sensors or self-reporting. Examples are electrocardiographs, prescription compliance, or the patient's vitals or glucose levels. Often, patient digital information is contributed to national data banks. The objective of healthcare big data analytics is to help identify risk factors, increase the accuracy of diagnoses, and strengthen the consistency of healthcare delivery in alignment with evidence-based medical protocols. There are advantages to cloud-based storage systems for telehealth. They can provide secure access to medical records for both clinicians and patients from anywhere they can access the internet. Use of cloud-based storage not only provides on-demand access to medical information, but also can reduce the costs associated with an in-house data center infrastructure, as well as provide scalability, flexibility, third-party accountability for compliance with HIPAA security and privacy regulations. Current HIPAA regulations have not significantly improved the public's level of trust in the security of their healthcare data. Nonetheless, they remain interested in using telehealth systems despite their privacy and security concerns. For most people, the convenience of rapid access to healthcare outweighs privacy concerns. Patients' trust in their clinicians plays an important role in the adoption of telehealth technologies. It contributes to treatment adherence, continuity of care, and ultimate care outcomes. The primary security risk is that of unauthorized access to data during collection, transmission, or storage. Any transfer offers the potential for a security breach. For example, home devices and sensors may collect information that a patient wishes to keep private, such as substance abuse or that the house is unoccupied at a particular time. When transferring data, there is also a risk that hackers may plant malware or distribute data to other parties. Existing regulation provide insufficient safeguards to protect patients' privacy and security. Currently, the HIPAA regulations require the encryption of patient data by covered entities, but not by the patients themselves. Thus, they expose themselves to their own risk. The Food and Drug Administration regulates medical devices, but not consumer apps. So the FDA promotes patient safety, but not patient privacy. During telemedicine encounters, patients are also vulnerable to signal errors, transmission outages, or communication with parties that are not actually the patient. These incidents can result in loss of data and unauthorized disclosures, which in turn can lead to HIPAA privacy and security violations. There are ways healthcare organizations can reduce their security risk. For example, appoint a HIPAA security officer to conduct audits and oversee compliance. Ensure data is always encrypted when transmitted. Perform due diligence reviews on all IT-related vendors. Provide physicians and staff training on data security risks and safeguards upon hire, and at least annually for the duration of employment. It's up to healthcare organizations to proactively apply best practices. When introducing telemedicine into an organization's value chain, there are many factors that come into play, including costs, benefits, and risks, as well as how to go about the selection and implementation of the technology. The first factor to consider is cost, which varies based upon the approach. Developing a custom system is costly and estimated at greater than $1,000 per patient or $25,000 for a small practice. One can use a consultant to integrate the data generated by telehealth apps and devices into an existing patient database or electronic health record. This is risky because interoperability between software programs is not common. Another cost structure is to outsource the capability entirely. Some vendors offer their software as a service, charging based upon the number of providers or patients or factors of both. Another factor to take into consideration is how much hardware the capability requires. A small practice could run with little investment, relying on the patient's access to smartphones and computers. The practice need only ensure stable and fast internet speeds on their end. Some telemedicine capabilities require highly specialized equipment and trained personnel in order to provide remote monitoring of a patient's conditions. This would be considered a medium or moderate level investment. An example of an organization that is fully invested in telehealth capabilities is Nicholas Children's Hospital in Miami. They provide not only e-visits for their patients, but they can provide remote surgical consults using their closed-circuit television systems. A healthcare organization using telemedicine generates several saving points, not only for the organization, but for providers, patients, and other parties. The average cost of telehealth care per patient, according to the American Hospital Association, is greater than $1,600 per year. While in a hospital run by the Veterans Administration, that same care would cost $13,000 per year, and in a nursing home, it would cost $17,000 per year. According to the same study from Rand Incorporation, 88% of the visits for telemedicine were for new patients who might not have received care otherwise. There are also positive effects in the environment. Over a period of 18 years, telemedicine has saved patients 9 years on travel time, 5 million miles of travel, and $3 million, resulting in green savings at estimated 2,000 metric tons of carbon dioxide. Besides data security and privacy risks discussed earlier, there are other risks associated with telemedicine. Basic telemedicine platforms rely on patient interviews and description of symptoms, while more advanced platforms obtain vitals through sensors and devices, thus reducing the patient's risk of misdiagnosis. Patients could lie about their geographic location to access a physician not authorized to perform medicine in their state. There may be exposure to malpractice litigation based on technology providing inaccurate data, leading to misdiagnosis and adverse outcomes. Telemedicine platforms have both personal and financial patient information. These are prime targets for financial and identity theft. Also, proof of identity is hard to verify via telemedicine. Patients could provide other patients' information to obtain controlled substances. There is also the risk of non-payment by the patient or the insurance companies. Non-standardized payment policies have delayed the expansion of telemedicine in many states, as is the case in Florida. In addition to cost, benefits, and risk, a healthcare organization must consider the challenges of implementing the technologies. Of course, providers need to be trained how to use the platform, but just importantly, they need to learn about the etiquette and risk of evaluating patients online. According to the American Telemedicine Association, special care is required with pediatric and geriatric populations. In addition to training, it is important to verify all legal disclosures, billing and coding protocols, and GPS settings are correct to ensure services are being performed according to the geographic boundaries established by the licensing boards. Integrating the telemedicine data into the organization's existing infrastructure is a major consideration when selecting a capability provider, especially if the organization is committed to using only electronic records. Healthcare organizations running hybrid systems do not experience many challenges because most Telemedicine 2.0 platforms generate PDF records. Unfortunately, Telemedicine 2.0 platforms still are not compatible with all commercial electronic health record solutions. A major challenge is integrating the telemedicine data with an existing electronic health record platform. Fortunately, there are separate gateway solutions that facilitate this integration. Nonetheless, integration may be the most complex factor in the process of implementing telemedicine. Will existing provider systems be disrupted by telemedicine? If the value network configures as forecasted, yes. The evolving pieces of this new value network likely include more sophisticated remote diagnostic tools, more supportive payers, and interoperable electronic health records, although the exact nature of this ideal value network is still uncertain. The chief reason these value network factors are important is not because they will enable telemedicine to directly replace in-person consultations, but because they will allow providers in a new network to do things the old system wasn't designed to do in the first place: manage behavioral, mental, and chronic health conditions remotely. Overhead burdened health systems will likely welcome these moves to enhance their profitability, even if it reduces revenue. There are opportunities for disruption by telemedicine. 5 chronic conditions account for 3/4 of direct medical costs in the U.S. Certainly, the new market opportunity for telemedicine lies in curtailing these costs. Let's also look at some trends that are driving disruption in the healthcare field: the shift from episodic to continuous care and monitoring, multi-directional flow of information, and an increasingly specific knowledge used in decision making. For telehealth platforms to ride these trends, they will need to incorporate data streams of predictive analytics, genomic data, more monitoring data, and especially patient preferences and health goals. Telemedicine is experiencing disintermediation between the patient and their primary care network. Consumers are taking the reins as they look for more access, engagement, and transparency. They're also less attached to a specific physician and more open to non-physician clinicians, retail clinics, and other venues that make care more convenient. Almost more interesting than disintermediation, removing the middleman, is intermediation that adds the middleman back into the mix. Intermediation occurs when digital platforms interject themselves between the customers and a provider. These platforms are so large that businesses can't afford not to engage to reach their customers. Electronic health records are prime examples to create intermediation as a content hub. The traditional brick-and-mortar model of physician office visits is being challenged by video conferencing, particularly for the care of chronic conditions. As a result, patient engagement channel conflict has arisen within large provider groups. One can clearly see the economic benefits of telemedicine for the patient. However, the return on investment from the perspective of healthcare organizations has been unclear. Telemedicine is plagued by hazy economic cost and revenue measures, which are complicated by insurance reimbursement challenges. Recently, there has been some positive movement in reimbursement rules. Both Medicare and Medicaid have announced that they will be expanding telemedicine coverage. Medicaid now recognizes telemedicine as a distinct service and has made a variety of billing codes and modifiers available to states who want to use them. Consequently, one can anticipate that more traditional physician practices will start to add e-consults to their service continuum, and competition and channel conflict within large provider groups will begin to moderate. The future of telemedicine is being driven by recent events and trends. In mid-May, the Veterans Administration started to allow providers to deliver patient care across state lines and outside of VA facilities using telemedicine capabilities. It's called the Anywhere to Anywhere initiative. Telehealth is bringing care beyond traditional settings. Medicaid is supporting school-based telemedicine services in 18 states, and telehealth consults are beginning to occur in jail settings. Telehealth is a prosperous market and a lively sector for mergers and acquisitions. Recently, Doctors on Demand reported $74 million in revenue. Meanwhile, American Health announced the purchase of Avizia, another industry leader, for an undisclosed sum. The deal will allow American Well to use Avizia's custom software to expand into more than 40 telehealth specialties. Due to its enormous growth potential, several tech giants are targeting telehealth. They include Amazon, Apple, Google, Microsoft, Facebook, and IBM. Industry analysts say the reason is, quote, the telehealth market is too big, too important, and much too personal for their users for the tech giants to ignore, end quote. So if healthcare organizations don't drive telehealth adoption, it appears tech giants will.